Thank you, Christian, and thank you, Mr. Tedros. My question concerns Argentina's recent announcement that it will leave the WHO following the footsteps of the United States. What is your reaction, and do you fear this is leading to further exits and the formation of a global health system divided into blocks in the future? Thank you very much.
Thank you very much, Antonio. I believe we have Steve Solomon, our principal legal advisor, on the phone as well. If so, no, we start with the DG.
No, I will take that. So thank you for that question. We regret the announcement by Argentina, and I hope they will reconsider their decision and look forward to engage them. Thank you.
Thanks so much. Next question goes to Helen Branswell from STAT. Helen, please go ahead and unmute.
Thank you very much for taking my question. I wanted to follow up on a couple of things the Director General said in his opening comments. Do I read you correctly that you have had no engagement with the United States in terms of you said you would welcome the opportunity to have dialogue. Has there been none? There is no openness there to discuss possible other routes. And you also said that the WHO has limited information on avian influenza. Is the United States not abiding by its requirements under the international health regulations to report cases of avian influenza to WHO? Thank you.
Thank you very much. We'll start with Dr. Van Kerkhove.
Yeah, thanks very much. So I'll start with the second part of your question, Helen. So U.S. Is reporting cases of avian influenza through IHR channels. So we have had reports of a H1N2V, a swine virus, through IHR, a human detection. We've also had a human case of H5 that has been reported through IHR channels. CDC right now is not reporting influenza data through the WHO global platforms, FluNet, FluID, that they've been providing information for many, many years. And we have not had direct communication with CDC related to influenza. We are communicating with them, but we haven't heard anything back. We are receiving information on avian influenza through animal infections. USDA has published some information online, so we do know about some circulation that's happening in dairy cattle. But as DG has said, we welcome active technical exchange with our colleagues in the US. And there are very important meetings that are taking place, and we welcome, as always, the engagement of our technical partners in the US, as well as through all of our member states, and in fact, technical exchange with anyone, anywhere. Thanks.
Thank you. With this, we go to the next question. That goes to Nina Larsen from AFP.
Hello. Can you hear me?
Now it's better. Yeah, now we do.
Yeah, I wanted to follow up on that. In terms of the information that you're receiving from the U.S., are you confident that they are doing enough surveillance, and also that they are communicating the cases that are arising, or that there is a bit of an overview in case dangerous changes occur? And I also had a follow up on the question on Argentina. I was wondering if you could say, I know that the U.S. withdrawal, it'll take 1 year. I think that was only the U.S. That had that rule. So does that mean that Argentina has already withdrawn from the WHO, and what impact will that have on the organization? Thank you very much.
Yeah, we'll start again with Dr. Van Kerkhove.
Yeah, thanks. So I assume your question, Nina, was related to avian influenza, although I don't think you put that in the question. The U.S. has a very strong surveillance system for influenza. And prior to a few weeks ago, we had active dialogue with our colleagues at US CDC, with HHS, with FDA, with USDA, with many. And the reporting was coming through online platforms like I just mentioned with FluNet and Flu ID, but also through technical exchanges that we had with them on a regular basis, regular calls. We are confident that the U.S. has detection capabilities to identify zoonotic influenza in animals, in humans who are working with exposed animals or infected animals. We encourage the dialogue to continue with us and that technical exchange. We encourage reporting through IHR, and they are continuing to report through IHR. We had been very active in working with US, with our WOHA colleagues, with FAO colleagues to strengthen surveillance in animals, particularly in dairy cattle, to see what more could be done at looking at preventing transmission between herds to new animal species, to look at biosecurity on farms. And that work was starting, that work was underway. We are doing this in a number of countries around the world because zoonotic influenza is a risk globally. So there is a strong surveillance system that is there. There are reporting mechanisms that exist. And as the DG has said, we encourage that reporting to continue through the online platforms that they have and for the dialogue with us to continue.
Thank you very much. Then we should go maybe to Steve Solomon again, our principal legal advisor for that second part. Thank you.
Christian, thank you. So the question of Argentina or any country withdrawing from WHO has a number of dimensions to it, including legal and historical. It's fair to say in this sense that it is not straightforward. So as a legal matter, the WHO Constitution, the UN Charter, does not have a withdrawal clause. This was because the drafters of the Constitution were aware of the importance of global health being addressed in a way that is truly universal, so as to leave no one behind, so as to promote health for all countries and their people. So the question of whether withdrawal is possible, and if so, how it would be given effect and under what conditions, is a matter of interpretation and ultimately a question for the World Health Assembly. So how is it, as the questioner asked, how is it that the U.S. has announced its withdrawal if the WHO Constitution doesn't have a provision for withdrawal? The answer is that the U.S., when it joined in 1948, made a reservation where it reserved for itself the right to withdraw. All other WHO countries at the time agreed to this. They accepted the U.S. reservation. Only the U.S. made this reservation. No other member state then or since has made such a reservation. So what about the member states without a reservation? Historically, in the first decade of WHO's history, there were a few cases where member states without a reservation announced their withdrawal. However, these cases were not regarded by the World Health Assembly as withdrawals. The countries involved were regarded as having inactive status. They were not regarded as having effectively withdrawn in a legal sense. The question of how any announcement of withdrawal by member states without a reservation on withdrawal, the question of how that would be handled now in 2025 would be a matter for consideration again by the World Health Assembly. The World